The Cleveland Clinic's Taussig Cancer Institute ranks among the top in the nation for treating adults with cancer. It's an exciting time as the clinic makes advances in research and treatment. The clinic is expanding the services it provides and the patients it can treat through its brand new cancer facility.
Our focus of clinical care and multidisciplinary care and working together is one way. I think another way is the clinic is known for innovations and our innovative spirit. We're willing to try new things. We actually like kind of trying to break the mold and to approach things in a different way.
With its patients first motto in mind, the Cleveland Clinic provides the community with compassionate care. This is accomplished by constant education and forward looking research, training its top medical professionals, and assuring cancer patients that clinical trials will actually bring them the latest treatments and procedures.
There's a perception that if you're on a clinical trial, you're being experimented upon. My own mother says to me, and this is ironic since I have made my life around clinical research, that she doesn't want to be a guinea pig. She wouldn't enroll on a clinical trial because she doesn't want to be a guinea pig. The clinical trials we have available are designed so that at the very least, our patients are going to receive the standard of care for their cancer. Often our clinical trials are adding to that standard to see if we can do better than that standard.
The one clinical trial in pancreas cancer that we are very excited about is looking at whether chemotherapy is more beneficial upfront before surgery. This is a very novel approach to the treatment of pancreas cancer. So typically patients with pancreas cancer, if they're resectable, are taken straight to surgery. But we and other people have hypothesized in the past that cancer is really a systemic disease. And so it makes sense to come with systemic therapy first and then to do local therapy such as surgical therapy or radiation therapy later on.
While there are 6 departments involving cancer care, that doesn't stop the clinic's medical professionals from reaching out to their colleagues. Acting as a team helps them keep individual egos down and patient care up.
There's no doubt in my mind that working together and keeping each other in touch on the care of a patient improves their outcomes. We don't work in isolation. And in my understanding of even scientific literature, the collaborative care that we provide actually provides better outcomes than just individual specialists doing what they do well.
When they come to the Cleveland Clinic, and certainly to the Taussig Cancer Institute, is that we believe in a multidisciplinary approach for their cancer care, whereby it's not only about my patient only, it's about me being able to facilitate the care from different specialties within the enterprise. So if you need urology, you may actually be able to see a urologist the same day. If you need radiation oncology, that would be the same instance. And I think that's a unique setting for us within the institution.
The care that the Cleveland Clinic provides each patient and the cutting-edge treatment it delivers makes it a unique place where doctors want to stay to work and what attracts new doctors to join the team.
We're patient-centric. We want people who have a lot of talent, but we also want people who have a lot of emotional intelligence. That's very important to us in our culture. We're trying very hard to have a very positive and empathetic and caring culture that is also filled with people who are very, very good at what they do. I mean, at the end of the day, people come here at a very sick point in their lives and they want us to help them. And we need to be very good because a lot of people come here because we're the Cleveland Clinic, and we want to be as good as anybody in the world is at taking care of cancer patients.